Hi guys, it's Rishmina and welcome back to the Peppy Podcast. Welcome. I'm your host and today we're in conversation with Sohini Mukherjee. Sohini is a counseling psychologist and academician based in India. She'll be speaking to us today about trauma and therapy. So welcome Sohini and thank you for making the time for us.
Hi, Rushmina. Very good evening. Thank you. Thank you so much for having me over here.
It's great to have you here and I have a few questions. I wanted to ask you if you're ready, I'll start.
Absolutely. Yes.
Okay, so my first question to you is why did you choose to be a therapist?
Okay. So to begin with this, is it okay if I go in points? Like I have a few points to state. So I
Sure.
would just go in points then. All right. So see, I very randomly had chosen this subject in my plus two, but primary my heart reaches out to, or whenever I think about choosing this subject, the first thing that pops up in my mind is the people who taught me psychology. So basically my teachers at school and my faculties, and they were extremely brilliant in inculcating this idea of psychology into my mind. And uh, from then onwards itself I wanted to be a clinician, but it's always dicey. We are never too sure about what, because in psychology offers a diverse range of career paths itself, so we were not very sure. So
Mhm.
once I was in college, I remember when my professor, she introduced herself to us. She asked us, she asked us, why did you take up psychology? A very basic question that's generally asked in introduction or orientations. So I remember we had all different answers for her, but some of us answered that we want to study human behavior and we want to help people and all of that. So I will always remember the response she had for us, and she said that you cannot know someone better until and unless you know yourself, until and
Hmm.
unless you accept yourself for the way you are, and you gain an insight into yourself, you will never be able to reach out to others. And that is the thing which had hit me the most, that
Hmm.
do I even know myself, that I'm out on this journey of helping others.
Hmm.
So this was the first point where I realized and I wanted to explore my own self. And in the journey I came across different people who have encouraged me, who have motivated me in their own ways. And I just realized that this is my calling, because knowing myself has been a pleasure, accepting myself has been a journey. So why not reach out to people and try and explore behavior now? So
Wow.
yeah, this
Wow.
was this was the beginning of the journey.
That's great. And so how has it been so far for you?
Okay, so it's not like I have been practicing for years. I've just started off. And one thing I would like to share with you as a beginner when it comes to being a clinician is that it's very overwhelming to begin with, firstly, because you see variety of cases. And from one thing I would like to mention that I have done in my course of practice is that, very speaking very technically, is I had kept the monetary part very nominal. I had done that initially, and even till today I have it, because I believe that therapy cannot be for one class of the society.
Hmm.
Therapy, this idea that okay, therapy is a luxury, this is the first thing that we have to rule out.
Hmm.
Because when it comes to medical help, it's for everyone. It cannot be for one strata of the society. And especially speaking of India, we know that it's a diverse country when it comes to culture and socioeconomic background and language and everything. So in order to touch the different stratas of the society, this is something I had always wanted to do. And I will tell you one thing that I think I have to some extent been successfully doing it, because I see a wide range of clients from different parts of the society, from different socioeconomic backgrounds.
Mhm.
And when they come and tell me at the end of the session, when I'm terminating the sessions, this feeling that with my own hands or with my own thoughts, my ideas, my belief systems, I could touch people to some extent, even save them. And
Mm.
there are some families who have literally told me that, you have given us life. And if we
Mm.
when we wake up in the morning, the first thing we think about is you. It means a lot. It The feeling I cannot explain. It Words will fall short, but it's absolutely overwhelming as well as thrilling at the same time. It's a very weird combination, and it feels great. It is stressful, yes, I won't lie. It is a huge load to listen to patients, to clients throughout the day, and keeping them in the mind and also not keeping them in the mind at the same time, by
Mm.
which I mean compartmentalization, which is a
Mm-hmm.
very important part of therapy and practice. Is it's You cannot be preoccupied with saving your clients. You're not God. So
Mm-hmm.
this is something we have to battle with as well as accept at the same time, that you want to give them a new life, but you cannot take the full responsibility of giving them a new life. So
Mm.
it's a duality continuously going in our minds, and it feels very fulfilling and very enriching at the same time.
So, what would you say is the best thing about your job?
So the best thing about my job, to say very in to to give a very individual perspective, is I love meeting new people.
Mm-hmm.
I love listening to them. And the best part is that they all the stories, I would say stories, I would not use the word cases, because I listen to them like stories, because each person has their own story to tell. So I believe, it's a very personal journey, because the best part about therapy that I feel is when you talk to people, you talk to clients, and while you are therapizing them, you are somewhere therapizing your own self as well.
Mm.
Because when you are saying things out loud, it's also entering your own ears and your own mind.
Mm.
So the personal issues that we go through as human beings, as we all go through, irrespective of the fact that we are therapists, I'm a therapist, I'm a medical practitioner, irrespective of that fact, we all have our own personal hassles that we are dealing with every day. So when I'm therapizing people loud and clear, I'm somewhere also therapizing myself all the time. And that is what keeps me going as well. That is what
Mm.
keeps me motivated to go out over there every day and begin afresh, irrespective of sometimes the scenarios within the chamber, within the setup, becomes really um, hard. It becomes really overwhelming. It becomes really difficult. Sometimes we have to raise our voices in order to make people understand, not like shouting or screaming, of course, but making a point loud and clear. So when we are saying it, we are hearing it ourselves. Plus, it's a continuous process of growing. You yourself grow as a practitioner when you practice.
Mm.
Every single day is a new challenge, and every single case, every single story is a new challenge. Nothing adheres to the textbook, for that matter. And yeah, so kind of that, I believe that when I see clients, I somewhere grow myself every day,
Mm-hmm.
and I influence myself along with other people. So that's the best part of therapy, I feel, as a practitioner.
That's beautiful. And what would you say is the toughest thing about doing this job?
Oh, so the toughest thing is about being available, because as I said, as I mentioned before, it's a kind of duality constantly we are going through. You want to be available for your clients all the time, because you know that they are vouching on you, they are looking up to you, they're depending on you. But again, you have to have very well maintained boundaries between yourself and the client, because there is a concept which I would like to talk about a little bit.
Mm-hmm.
It's called transference and counter transference. So
Okay.
transference is when you have been seeing a client for a really long period of time, or the rapport is so good that your client starts feeling a special bond towards you, and irrespective of the biological sex or the gender, the client feels that you're the only person in the world who understands him or her. So that becomes a little difficult while terminating sessions, because even when you realize that they are getting better, they don't want to leave you, they want to keep coming to you, and
Mm.
that creates a dependency. That's one thing. And counter transference is when we as practitioners, we develop a soft corner for some clients. With some people, with some clients, we develop such good relationship, such good bonding, that we also, we also ask them how they are and how have they been doing, and we never, we don't, I don't especially forget about them. So
Mm-hmm.
maintaining those soft yet very well defined boundaries, I feel, is very difficult in our job.
Mm-hmm.
You cannot attach yourself to someone, but also you cannot detach yourself to someone with someone. You have to be available, but also not to be too available, so that that person becomes dependent on you. You have to affirm to a lot of their ideas which you realize are not so appropriate or not so valid, but you cannot directly say to them that, no, this particular thing doesn't hold true in reality, or you're just being impractical, although that is the first thing that comes to our mind, that how can you say this, it's you're just being impractical, but you cannot say it out loud, because you have to be very careful of what you say, but it also should create a good amount of impact in that person's life. So your words have to be impactful, but also gentle. So
Mm-hmm.
if I can make you understand, if I can explain it to you, it's a constant duality. It's kind of maintaining the best of both worlds.
Mm-hmm.
That you're strict but you're lenient, you're affirmative but you're not, you're assertive but you aren't too assertive that you become rude, you
So
get
very,
attached but not too attached.
so very fine
Yeah,
line.
very very fine line. I feel that people who are psychologists, who are clinicians, who are heavily into practice, we feel that we are always, I cannot tell about everyone, of course, I should not be generalizing, but I feel with my years of practice, the little amount that I've had till now and experience, is that we are always walking on thin ice,
Mm-hmm.
little bit here and there, and we might end up impacting a person in a very negative way, because whatever we say, whatever I as a practitioner say, I am extremely sure that it means a lot to the person who is sitting on the other side of the table. And they are looking up to you, the clients look up to you, like whatever you say is the last thing.
Mm-hmm.
So what you say is extremely important, and it has to be extremely meticulous, but also seem like that it's not rehearsed,
Mm-hmm.
that you are natural with it.
Okay. So, my next question to you is, how can you tell when someone needs professional help? Are there any red flags?
All right. So to answer this question of yours, Rushmina, I would like to talk a little technically, if that's okay.
Mm-hmm.
A little textbook, maybe. So, in order to diagnose a person as per se, there are certain criterias that we need to follow. These criterias are generally mentioned in the Diagnostic and Statistical Manual of Mental Disorders, DSM, or in ICD, International Classification of Diseases. So, for example, the word depressed or
Mm-hmm.
anxious, we use it very lightly in our daily lives. I am depressed. I don't feel like getting out of bed, and you know, uh, um, I don't know what I'm doing with my life. So depressed and anxious, obsessed, another word, has become very much a part of our regular vocabulary. It's good
Mm-hmm.
that people are getting aware of these terms. People are taking care of, trying to take care of themselves at least. But at the same time, it's also becoming very local, I feel.
Mm-hmm.
Okay. So, for example, when someone, I'll give you a very classic example. Say someone is coming and telling me that, I am very depressed. So the first thing I ask them is the question that you asked me, that, how do you know that you need professional help?
Mm-hmm.
So I ask them, how do you know that you are depressed? Who told you? So their reply, of course, is no one, maybe Google, we searched up our symptoms, or I feel I'm depressed. So then we have to make them sit and understand, or we should psychoeducate them in the first place, that okay, how long have you been chronically sad? How long has your mood been persistently low? Do
Mm-hmm.
you have insomnia or hypersomnia? Do you have suicidal ideations? You may or may not have. Do
Mm-hmm.
you feel a lack of appetite? So in DSM, there are certain, or in the manuals, ICD as well, there are certain criteria.
Mm-hmm.
If the client matches those criteria, minimum 4 to 5 of them, only then you can give the diagnosis. Otherwise, you cannot. Uh, I have been sad for a week. No, it's not depression. The sadness needs to be consistent and needs to be persistent for over a span of maybe few weeks, 2 to 3 weeks. Then you can give it, the diagnosis of major depressive disorder. If the sadness has been there with 3 4 other symptoms that I mentioned for over 2 years or 1 or 2 years, it's dysthymia. It's not even depression anymore.
Hmm.
So, according to the classification, we give the diagnosis. That is the technical part that I wanted to say. And if you ask me very colloquially, how do we, when we see people or when we talk to people, how do we know that they need professional help or how do we advise them to take professional help? Is the part that we tell them that try to figure out that are you getting dysfunctional? And I would like to emphasize that word again, dysfunctional in your everyday life. Do you find it difficult to going do you find it difficult to go to your job? Do you find it difficult to talk to people? Do you find it difficult to you know feel happy, basic things? Do you find it difficult to brush your teeth, take a bath? Do
Hmm.
you find it difficult to restrict your excessive amounts of thoughts? Do you find it difficult to stop crying if you are sad? So, if your everyday life is getting disrupted in any way, that's the primary area where we realize that, okay, we need professional help.
Hmm.
That is why it is called disorder. Disorder means when the order of everyday life is being broken down, it's called disorder. That's why we say dot 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 disorder,
Hmm.
depressive disorder, anxiety disorder. But if you're functional in your everyday life, you can still be sad, not depressed. You can still be anxious and not have anxiety disorder. You can still have obsessive traits, but not OCD. This is the major difference,
Hmm.
is that your order is being broken or not.
Hmm. Okay. So, the next thing that I want to say is that emotional pain can't really be seen and it can't be measured on a medical device.
Yes,
So,
yes.
how do you look at someone and know how big or small this problem is?
To be very honest, Rushmina, we never know actually.
Mm.
We never know the intensity of how much their pain is. You will never be able to imagine being on the other side of the table, the amount of pain and the depth of pain that they are going through. Every single person has their own depth of pain.
Mm-hmm.
Every single person has their own duration of suffering.
Mm-hmm.
So, empathy that we have as a quality to be a therapist, that we require to have as a therapist, is it's very general. It's empathy is something we feel for everyone, but to understand the depth of emotional pain, I don't think it is ever possible, because you can never put yourself in that person's shoes or even imagine the amount of suffering and the amount of trauma or pain that they have been through. But
Mm-hmm.
if you still ask me if there is any quotient with the help of which you can measure emotional pain, is then you have psychometric tests
Mm-hmm.
like depression tests, anxiety tests, personality disorder scales, psychotic rating scales. So
Mm-hmm.
with that, you can find the score, that mild, moderate, severe, where does your depression lie? Mild, moderate, severe, where does your anxiety lie? And with the help of scores, you get a fair idea that okay, it's very intense or it's not. But
Mm-hmm.
that's very objective. That's very technical. If very subjectively you ask me, it is, I feel it's my very personal opinion. I might be wrong. It might be subjected to discussion. But emotional pain, understanding true, original, core, in depth emotional pain is next to impossible,
Mm-hmm.
because you cannot get under that person's skin and feel exactly to the point what they have gone through. And until and unless you feel that, you experience that, it's very difficult to understand.
Mm-hmm. Okay. So, my last question to you is, what is one piece of advice that you would want to give to everyone?
So, the one piece of advice that I would like to give to everyone is that, firstly, I would like to say that we are all subjects of some kind of generational trauma, some kind of passed down, um, some kind of passed down emotional overbearing baggages that we need to first identify. It is very important for us to identify that okay, I am having a problem. Let's begin with that, that yes, I am having a problem. And let's not normalize things that, okay, it will go away with time, and let me see, let me talk to a friend. Of course, socializing, social interactions are absolutely important. Being um, involved in your everyday life is absolutely important, but also identifying that you have a problem, identifying that you are the carrier of some kind of generational trauma is extremely important. The next step to identification would be acceptance, that yes, I have it, let's sit down, let's make peace with it. I have a problem. Acceptance does not mean normalizing it and moving ahead with your life, because if you have it, if you have an issue, which is very probable in today's world because we are constantly hustling with something or the other. Um, it's very probable that we might be carriers of something or the other. It's very important to sit and accept that yes, I have it. My parents had it, my family had it. I have imbibed it, and that's fine. I have it and I accept it. The third step would be to ask for professional help and not go on Google, because on Google information can be edited manually. There is a lot of under researched and over researched information, dramatized information. So
Mm.
the third thing would be to ask for professional help. The journey doesn't end over there. If you have gone to a professional for help, if you think that you are not comfortable with the professional's body language, with the rapport that they are trying to establish with you, very much possible. Do not continue over there because you have decided one fine morning that you want to get better. You can, of course, you can, of course, explore some options. And the person you get the most comfortable with, you can start your journey of therapy with that person. And even then, there is still some work left for you. That will be following the guidelines that the therapist is providing to you, number one. Number two is being very open and frank with the therapist that, okay, this guideline that you have provided is not working for me, because what the therapist is providing you is just from an assumption, with just from an idea that, okay, this might help you. The
Mm.
therapist's idea is not to advise you or give you opinions, but these are the things that might help you. But if it's not, you have to go back and tell your therapist that, okay, these two, three things you have mentioned does not work for me. Then he or she will give you some other options. So it's a constant interaction. It's not a teaching learning process. That it's a learning process, yes, of course, but it's not like a one directional teaching learning process. And you have to have faith in time, in patience. You have to have faith in the journey. Overnight, nothing gets fine, nothing gets better. Just think like this, that whatever your age is today is the amount of time you have been the carrier of this problem. Maybe a few less years, but more or less. So it cannot be, why is it not happening? I don't want to continue anymore. It doesn't happen overnight. It takes a lot of time, lot of patience, and lot of faith in the person who is trying to make your life better day by day, every single day in a different way. So these are the steps I would like to suggest everyone. Identify, accept, reach out, cooperate, interact, and finally, you implement it in your everyday life and you will see the outcome. And
Mm.
you will, I bet you will. You just have to keep holding on to
Mhm. That's
it.
really inspiring.
That would be my little piece of advice to everyone out there who will be listening to today's podcast. And
Mm-hmm.
just reach out. It takes a call. People are just a call away. Mental health is a universal right now. It's a global thing now. Just reach out. Don't think about what everyone else is going to think, because they are not going to share your pain, your trauma. No one can. No one can even imagine what you are going through. Your family, your friends, everyone is there. That's fine. That's a support system. That's not treatment. Let's not confuse between a support system and a treatment. A treatment is something which is being professionally and neutrally and unbiasedly provided to you. And
Mm.
that is going to be very core and very in depth and with a lot of patience and faith.
Mm.
So, yes.
Mm. Thank you, Shohini. That brings us to the end of our episode. It's been really great having you here. Thank you for listening to the Peppy Podcast, and I will see you next time. Bye.
Thank you. Thank you, everyone. Thank you, Rishmina.
Bye.
Bye bye.